Welcome to another talk in the pulmonary rehab program. This is a talk on bronchiectasis, and I'm going to start by just revising a little bit of the basic anatomy and function of the lung, and then we'll go on to talk a bit about what bronchiectasis means and how it manifests in the lung, and then we'll finish up by talking about the treatment of bronchiectasis, the various modalities of treatment that help patients with bronchiectasis feel a bit better. So firstly, a bit of revision about how the lung works normally. And the lung is pretty simple really. It's made up of just basically three parts. There are the airways that take the air in and out of the lung. There are blood vessels that pass through the lung and pick up oxygen from the air inside the lung. And there are the spongy bits of the lung, which are the bits that do the work in transferring oxygen from the air to the bloodstream. So these two diagrams really encompass all of lung anatomy and physiology. Here is a cartoon of the airways, the windpipe, which divides into two sides, one for each lung, one on the left, one on the right, and then the bronchi, the tubes within the lung, conducting the air down into the air sacs or alveoli. This is an alveolus with the air coming in and out through a single portal of entry through the small airway here, and then the blood coming in on this side of the alveolus, passing around the air sac, which has a convoluted large surface area, and leaving on the other side. And you may notice that the blood entering the lung on this side is blue in colour because it has little oxygen in it, and as the blood passes around the air sac it picks up oxygen from the air inside, such that when the blood leaves the air sac it's bright red in colour, full of oxygen, ready to be distributed around the body. So there we are, the three parts of the lung: the airways taking the air in and out, the blood vessels taking the blood through the lung, and the spongy bits that are really doing the work. So that's a bit of revision. Moving on to bronchiectasis itself. So what is bronchiectasis? It's one of those long, medical, complicated words made of smaller bits and pieces. The first bit is bronchi, which means airway or breathing pipe. And the second bit is ectasis, which means distended or stretched or larger than it should be. So bronchiectasis is a disease where the airways are larger than they should be in places. We're going to go on and look at a normal airway here. I've drawn a tube, which is supposed to represent an airway in the lung. And these airways are self-cleaning, so they have a mechanism within them to keep them clean, to keep your lungs clean. And that mechanism is made up of lots of little hairs called cilia, which are microscopic things, too small to see with the naked eye. And they lie in the surface membrane of the airways, and they're constantly wafting upwards. And on the surface of those cilia, we have a layer of mucus, which is secreted by the cells of the airway wall. And this layer of mucus is constantly transported upwards from the lower part of the lung towards the main airways. So we have a layer of mucus that's moving upwards. It's rather nicely called a mucociliary escalator. You think of those escalators in the department stores constantly moving you up towards the cafe on the top floor, and this is where the mucus is going in the airways to the trachea, where it can be coughed out. Now the function of this layer of mucus is to keep the lung clean. So if you happen to be in the cafe at John Lewis and you're having your toasted tea cake, and there's a bit of a crumb of toast here, which makes its way into your lungs rather than into your gullet, it will get trapped by this mucus within the tubes of the lung. It will get caught like a fly on sticky fly paper, and it will get transported upwards out of the lung to the trachea and then coughed out. So bits of toast or bugs or pollution, particulate pollution that is breathed into the lung, is trapped in this mucus layer, enveloped and transported out of the lung before it can get further down and cause damage to those delicate air sacs that we talked about before. So this is a normal lung with a mucociliary escalator keeping itself clean. Now here is a bronchiectatic airway, where part of the airway, for one reason or another, and we'll come on to that later, has become distended. So the cilia above the abnormal airway are working okay, but the cilia within the distended airway are disorganized and don't work properly. And then the cilia below are okay again. So we have mucus coming up from the depths of the lung on the mucociliary escalator, but once they get to this distended, damaged part of the airway, which is wider than it should be, which is distended, the mucus, rather than transporting up through the lung, sits in puddles in the airways. So you get globules of mucus sitting in these damaged parts of the airway, which become stagnant. So we've got stagnant puddles of mucus. Here they are, the stagnant puddles of mucus. And the consequence of this on the self-cleaning function of the lung is that if you breathe in a bug and it lands in the mucus in the bronchiectasis part of your lung, then the lung can't clear the bug out of the chest. Normally, if a bug landed in the lung, it would be moved out by the mucociliary escalator. But under these circumstances, these gobbets of mucus are stationary, and the bug lands in there, and the lung is unable to clear the bug from the mucus, so the bug will multiply down here. It's a nice place if you're a bug. It's nice and warm, there's plenty of food in the form of mucus, so the bug will set up home or colonize the airway, and the bug will become a permanent resident in the lungs. A normal healthy lung is clean inside with no bugs at all because of this cleaning mechanism, but in bronchiectasis the bugs are able to survive in these puddles of mucus. And from time to time, particularly if you get run down, the bugs, which are constantly fighting a battle with your immune system, can get the upper hand, and they can multiply even more so to cause not just colonization but an infection in the lung, and the infection will bring with it symptoms like cough and mucky sputum and generalized malaise. So here is the bronchiectatic airway with the bugs colonizing and on occasions proliferating to cause infection in the lung, all because the mucus can't get out of the lung normally. So that's what bronchiectasis is. We're going to move on a bit now and talk about how we might treat bronchiectasis, but firstly we'll talk about some of the causes of bronchiectasis. The first and commonest cause, more than 50% of cases in most studies that have looked at this, the commonest cause is the idiopathic cause, which is a fancy way of saying we haven't got a clue why it happened. So an unknown cause is the commonest in series of patients with bronchiectasis. The second most common cause is post-infectious, where there is a clear history of the patient having had an infection. It might be a tuberculosis, it might be whooping cough in infancy, it might be any kind of infection that causes damage to the breathing pipes, and that can lead on to bronchiectasis. So post-infectious is the commonest diagnosis that we make when we make a diagnosis. Other things that can cause bronchiectasis are obstruction to an airway. So if you breathe in a Lego brick or a peanut and it gets stuck in your airway, it disturbs the flow of mucus, causes obstruction, and bronchiectasis will develop downstream to the obstruction. So a foreign body or indeed an intrinsic problem in the lung can cause obstruction and then bronchiectasis. Less commonly, but perhaps more severely, disordered immune function is a common cause of bronchiectasis. So people who have a disordered immunity, so their white blood cells or their antibodies are deficient in some way, and they can't win the battle against bugs in their chest, so they're more likely to develop bronchiectasis. And lastly, there are a whole list of various inherited conditions like, for instance, cystic fibrosis or primary ciliary dyskinesia, where the little cilia don't work normally. These are usually inherited conditions that lead to the development of bronchiectasis. You'll notice that there's a common feature in all of these, which is disturbance of that mucociliary escalator, allowing infection to persist in the airway and cause damage. So there's the list of causes of bronchiectasis. And then now we're going to talk a bit about treatment. Treatment of bronchiectasis is essentially pretty simple. We're trying to put right what's gone wrong, and what's gone wrong is that the mucus can't flow through the lung properly. So one of our prime aims is to get the mucus out of the chest. And the second tool in our toolbox is to treat the bugs, and we use antibiotics to try and reduce the number of bugs in the chest. So firstly, talking about getting the mucus out of the chest, the mainstay of getting mucus out is to use various physiotherapy techniques. And physiotherapy is just a way really of clever coughing to get the best out of your cough reflex, to help the cough remove the sputum from the chest. In most patients with bronchiectasis, the bronchiectasis is at the bottom of the lungs, lower down, and gravity is against us because the bronchiectasis is down there and the sputum tends to pool at the bottom of the lungs. So one of the mainstays of physiotherapy is to use gravity in our favour by tipping the patient upside down, something we technically call postural drainage, but essentially it means getting the bottom of your lung above your head to allow the mucus to drain out. So postural drainage is a main part of physiotherapy, if you can do it, postural drainage. There's also a variety of methods of fancy breathing techniques to allow you to clear the mucus, and these are collected together under something called the active cycle of breathing. This usually consists of taking very deep breaths to get the lungs full and then breathing out quickly from a half-empty lung to help move the mucus up the airway. So postural drainage and the active cycle of breathing are basic physiotherapy techniques to help clear the mucus. And then we can use some drugs to help liberate the mucus and make it easier to shift. We sometimes use normal saline, which is just salty water in balance with the body, via a nebulizer to help liquefy the sputum. So you'll breathe in this mist of salty water which loosens up the sputum. We sometimes use Ventolin, which is one of the inhaled drugs, again via a nebulizer. And Ventolin not only loosens the sputum, but it makes those little hairs work a bit faster. So it encourages sputum clearance. And we sometimes use drugs that make the sputum less sticky. One of those is called Mucodyne. That's a tablet which you take, and that loosens the sputum. So there are a variety of physical therapies really, salty water, Ventolin and Mucodyne, which can all help loosen the sputum and make it easier to clear. And there are some other devices which can help with your physiotherapy, like the flutter valve and the a cappella. These are both devices that you breathe into, and breathing into the device sets up a wobbly wave of air in your tube. So it's like shaking the tubes from the inside, and it helps shake the sputum loose. So these devices are really helpful, particularly for people who can't tip themselves upside down for one reason or another. So there's basic physiotherapy. There are a few drugs or physical therapies that we can apply to the airways, and there are the devices like the flutter valve or the a cappella, both of which helps clear the sputum. So sputum clearance is the main treatment for bronchiectasis, and anybody who's got bronchiectasis who coughs up phlegm on a daily basis should be doing some targeted physiotherapy on a regular basis. I should also say that regular keep fit activities like running or swimming or cycling are excellent physiotherapy for the chest, as well as these specific therapies. And then lastly, we need to talk a bit about antibiotics in bronchiectasis. There are a number of ways you can put antibiotics into the body to help deal with infections. Probably the commonest cause is to take a tablet. The commonest route is to take a tablet. So oral antibiotic therapy. And that can be either intermittent, so you just do it now and again, or it can be continuous. So you take antibiotics all the time to keep the number of bugs in your chest reduced. So tablet therapy, either as and when or continuously. That's the simplest form of antibiotic therapy. And then we can have inhaled therapy, antibiotics via a nebulizer. And then we can have intravenous where the antibiotic is injected into a vein, usually for a course of treatment and usually for something like 2 weeks of treatment. So these are the options for antibiotic therapy in bronchiectasis. The choice of antibiotic therapy depends largely on how bad the bronchiectasis is, how mucky the sputum is, and critically what kind of bugs you've got in your chest. So one of the things that your doctor will be asking you to do on a regular basis is to send sputum samples to the laboratory when you have a chest infection, and sometimes when you don't, to find out what the bug is. And the importance of that is that we get the right antibiotic to kill the bug that you have. There are some bugs in the chest that don't respond well to tablets and will almost always need intravenous treatment, and it's important that we recognize those bugs when they appear in the chest. So for somebody with mild bronchiectasis, the lowest level of treatment that you might expect might be 1 or 2 courses of tablet antibiotics a year, and that would be pretty mild bronchiectasis with a low level of treatment. One of the key questions is when to take antibiotics, and the most important deciding factor for this is how the patient feels. So rather than what the laboratory results from the sputum sample say, it's more important to listen to how the patient feels. Most patients with bronchiectasis are very well aware when they have a chest infection and when they need some treatment, and it's usually because their cough is worse than usual, they're bringing up more sputum than usual, they're bringing up sputum which is a different colour, or interestingly a different taste than the normal sputum, and they generally feel unwell. They may also feel a bit breathless, and a combination of those symptoms should lead the average patient with bronchiectasis to take some antibiotic treatment. What we're hoping to achieve with the treatment excuse me, is clearance of the sputum. So the sputum will turn from being a mucky green colour to being white again, and all those other symptoms should improve with the antibiotic treatment. So if you have mild bronchiectasis, you might expect to have to take antibiotics once or twice a year, and that would be all you would need. And with that level of disease, the prognosis is very good. The disease is unlikely to have any major effect on your life expectancy. It will continue to cause infections from time to time, so it's a bit of a nuisance, but it's not a life-limiting condition. With more severe bronchiectasis, and particularly with bronchiectasis where Pseudomonas is the bug in the chest, then there's an increased requirement for these other treatments, such as inhaled antibiotics, and we usually use an antibiotic called colimycin or colistin, or intravenous antibiotics, which have to be given directly into a vein. These intravenous antibiotics can these days be given at home, increasingly so at home rather than in hospital. So you may find that you come up to hospital to have a single dose of intravenous antibiotic just to make sure it doesn't upset you, and then the rest of the course can be given by nurses coming to visit you at home. So that's all I wanted to say really about antibiotic treatment in bronchiectasis, and that's the end of my talk. Thank you for listening.